Health, Human and Social Services meeting, and the first thing on the agenda is I need a motion to approve last month's meeting minutes. Supervisor McDevitt makes a motion, a second to that motion. I missed it. Supervisor Loeb. Any additions or corrections? All those in favor?
Aye.
Opposed? Carried. Thank you. With that, I will turn it over to you, Rob.
Thank you. Good morning.
Good morning.
Good morning. Okay, first item on my agenda is request to amend the 2019 Warren County budget. This is for some cost of living adjustment funds, 100% state aid from the New York State Office of Mental Health that we would like to be able to pass through to the People USA agency.
Someone like to make that motion? Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
Okay, next resolution request is a similar amendment of the 2019 Warren County budget to allow for acceptance and pass-through of $11,094, also 100% state aid from New York State Office of Mental Health for cost of living funds for the Warren Washington Association for Mental Health.
All right, someone like to make that motion? Supervisor McGowan, a second to that. Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. The next resolution request is a request for our 2020 contract with the state agencies. There's an attached Appendix A on the reverse of the request form, table that shows our agencies that we contract with and budget amounts and the budget codes.
All right, someone like to make that motion? Supervisor Sokol.
3, 4, and 5, please.
3, 4, and 5. It's all, if there are no objection, then we can do 3, 4, and 5. Someone like to second that one? Oh, I'm sorry.
I don't have an objection. I just have something to say.
Okay, can we get the can I have a second to that motion then? Supervisor McGowan. Okay. Mary? Go ahead.
I would just ask that the 3 contracts that you're approving, if we could have a 30-day termination clause and an appropriations clause. I talked to Rob about these contracts. They do them every year, and mental health is just a pass-through, so we wouldn't be giving these organizations any more money than Rob is getting from the state. And then this way, Rob and I can just do them every year, and you'll still see any increases or decreases because he'll have to bring the budget amendments through the board.
All right. Anyone have any questions? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. Then I did have an amendment to the packet that was sent out. There's an additional request in the packet I handed out. 2 requests actually. These are for reappointments to our Community Services Board for both, well, we'll do them one at a time, I guess. Amy Malloy, resident of Queensbury, has been on our board for previous term and requesting reappointment.
Someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. All those in favor? Aye. Opposed? Carried. Thank you.
My last request, another reappointment to Holly Arian, so resident of Queensbury.
All right. Supervisor Driscoll, seconded by Supervisor McGowan. All those in favor?
Aye.
Opposed? Carried. Thank you. Any committee member have anything they'd like to ask of Mr. York? Are we good? Okay.
Thank you.
Thank you very much. Have a nice afternoon.
Thank you.
I see it. Yes, it's your turn then.
Yes. I've been here the whole time. Sneak out.
What? That was a special chair.
It is a special chair. It's uncomfortable.
It is, isn't it?
We're all set.
Item number 1 is permission to amend our lease contract with the Cedars Summit Properties to increase the annual reimbursement from $14,935 to $15,383.
Would someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
Item number 2 is permission to submit our 2019-2020 MIPA grant application in the amount of $23,049. This is the Medicare Improvements for Patients and Providers Act. We did not receive this application until October 21st, and it's due November 22nd.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor Driscoll. Any questions? All those in favor? Aye. Opposed? Carried. Thank you. Did you have a question? Oh, I thought you did. All right.
Item number 3 is permission to enter into a contract with Orkin Pest Control for Pest Control services at all of our meal site locations, and the amount of $225 per call. It is advisable that we have a contract for pest control services in case anything comes up.
All right. Someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 4 is permission to fill a service specialist OFA position, grade 10, base salary of $39,633. We currently have an aging services assistant who's doing the work of this grade level, but she didn't have the educational requirements for the job requirements. Now she has she meets the requirements, so she'll be able to go out into this position.
All right. Someone like to make that motion for the approval? Supervisor Loeb, seconded by Supervisor McGowan. Question, Mr. Loeb.
Yes, thank you, Madam Chair. I just want to verify the amount, the dollar amount for the base salary.
Me too.
You said 39 or 37?
37, sorry.
That's right.
And this is the base amount. She has been in the, or she does have 3 years of service, so it would be a little bit higher.
Thank you.
Any other questions? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 5 is permission to transfer $6,925 from our Hamilton County contracts budget line to our Hamilton County full-time salaries and our Hamilton County part-time salaries to cover our salary expenses through the end of the year.
Someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
The next item is we recently had a gas shut-off at our Cedars meal site, so we were not able to use the ovens or the stoves for about a week. We gave Countryside all of the products that we'd already defrosted, and they were very helpful and helped us cook the macaroni and things that we needed. Just wanted to thank them.
Thank you.
Mhm.
That's Mr. McGowan.
Oh, do we have was it a red tag or just they were doing repairs or something?
No, they noticed an odor, which we had noticed previously and reported to them, and nothing was done. So National Grid came in and they smelled it and they shut it off completely. From the gas line to the stove where the leak was. They had to replace the tube.
It took a week.
Yes.
Thank you.
Mr. Beatty.
Yeah, I had lunch there last week, actually very good, with Mr. Supervisor Devin. And there was some, questions they had and so forth. One of them was, we spent thousands of dollars on these warmers, to keep the food warm, which is a good idea, I think, and, from a business standpoint, you have to have a certain temperature and so forth and so on. But we weren't using them, and that concerned me. So Mr. McDevitt and I said, well, those are beautiful warmers, but if they're not being used, then it really doesn't, help. So I guess there's an electrical issue there.
Yes, and that's the next item.
Oh, okay, well, good, go ahead, Mr.
Okay, go ahead, David.
Thank you.
So we did spend a little over $20,000 on these new meal transporter compartments that are electric, they're heated so that the food will stay at the proper temperature. We had checked with heaters, they were okay with us using them and plugging them in, and then they decided that they no longer liked the way that it was being used, that it was an electrical hazard. So they are requesting that we install 3 new outlets for these. It's close to $2,000. So I am asking the committee to see if it's okay to do that. I have reached out to Frank Morehouse to see if it's something that the county can do to either save some of the expenses or pay the county as opposed to an outside agency. But yes, until we have these 3 new electrical outlets installed, we can't use them the proper way.
Right. That was my understanding, too. We get the...
Even though we've gotten the okay use.
Yeah, well, we're going to use outlets, well, 1 or 2 outlets, and I don't know how many units you got, 15 units maybe, and it just wasn't feasible, obviously. And then I guess they were asking the Meals on Wheels volunteers to take some big units and put them in the car and plug them in. I said, what the? That didn't make any sense to me at all. I understand the ultimate goal is to get the food at the correct temperatures, and I applaud that. It just seemed to me that first because we got to have them plugged in at the cedars, maintain the food at the correct temperature, and not rely on the volunteers to be taking these units and putting them in their cars and trying to plug them in. So it seems like to me you're on top of it. Getting 3 new outlets is needed because the current, like I said, current formulation, if they had this wasn't working, wasn't viable. I don't know if Mr. McDivitt would like to add anything to that? Or?
No, when you're under basic guidelines and rules as it relates to the warmth and of food, you spend $20,000 on what we describe them as portable warming ovens. That you got to figure out a way to kind of keep the food warm. So I would kind of, just off the top of my head, I don't know this. I think I would question having the county do electrical work at a privately owned facility. I don't know if there's a way to move around that in a rational way, but my initial take would be to have a private contractor do it and do it as quickly as possible. So it's always an interesting day when we visit our seniors at the Cedars. So they're always thankful that I don't have to basically be a resident of the Cedars, that I'm healthy enough to take care of myself. But they did have some fundamental complaints relative to, can you get us rye bread as opposed to this standard wheat bread? They complained about the overall quality of the meats that they were getting in terms of stew beef. And again, when you're spending a lot of time alone in a senior facility, maybe you have a lot to think about, and as a result, maybe you just want to complain a little bit and let folks know what the heck's going on. So Doug and I think we attempted to be sensitive to their demands. I think you were going to take care of the snow days, weren't you, Doug? I think.
No, they brought that up. I said, that's all my league. That's over my pay grade.
Well, it was nice you fellas went and had lunch, but I want to go back here again. They're requesting for us to pay to install the new outlets, but it says they will not allow us to use the existing outlets. So they're not allowing you to use those to use those warmers. So what's the reason behind that?
Because they're saying that the capacity for the existing outlets, if we put these warmers onto them, it would exceed that capacity, causing the possibility for a fire.
Okay. All right, Supervisor Loeb, you had your hand up.
Yes, Madam Chair. Along that line, I suspect along with these 3 outlets, we're going to be putting in new circuits. But even so, $1,900 seems to be a lot of money. I don't know how that number was arrived at, unless they're stringing it from one end of the Cedars to the other.
I don't know. The last page is the quote that they received from Bean Electrical.
It is there. Okay, Supervisor McGowan?
Yes, just so everybody's kind of aware, these cooler systems are actually they're DC, and, you know, and they plug into a little converter box there, so you can go from electrical to, when you plug them into your car, you go into the cigarette lighter.
There's two plug-in options. There's one to go into a wall outlet, one to a car.
Yeah.
Several other Office for the Aged use these same transporters, and their volunteers plug them into the car. They're the same size as our existing coolers that we're using, so it shouldn't be an issue for them to just plug them into their car.
But plugging them into the car is actually to keep them warm on the transportation. It's always
Correct.
nice to warm them up before you put the food in. So, and we have 20 of them?
Yes, there's 20 of the large ones, and then there's 4 of the smaller ones.
And, you know, so that's a lot on the circuit. So I'm sure that they're going to be running dedicated circuits for each one of the outlets. I know Dean Electric, it says 8 outlets, each strip on a 120 amp circuit. So, that's reasonable for what they have to run, because they have to run it in a, you know, an MC coated cable, or either a conduit. I'm sure it's just going to be an MC, you know, cable. But I can understand the liabilities. But if the county can do it, but you know, Dean Electric is you know, more than capable. I've known this company for years.
All right. Spray my
But it sounds like that they want to hire Dean Electric and then just have us pay for it. So do we have anything in writing from Cedar saying that if we do that, they're actually going to let us use these outlets for that purpose? And do they charge us for the electricity for that, or is that covered in the current contract?
I don't know. Mary,
I have a note here to actually check the lease to see what the arrangement is, because I'm wondering if they're supposed to be providing the workspace for us to make the meals there. I mean, if they are, then I would argue these outlets are part of that. So I do have a note to check the lease.
Very good. Mr. Supervisor Sokol?
Brad McGowan, pro bono.
I'll take care of that.
All right, any other discussion on the electrical? Any comments from here? So, I guess we'll just move forward with that then. Are you then going to is Dean Electrical then going to be the one that's doing it?
Well, that's what my question is to you. Should I continue to work with Frank Morehouse to see if we can get the county to do it and pay the county? Or do you want me to move forward and have Dean Electric do it if it's something that's not covered by the current contract?
How does the committee feel? What do you think? Ms. Bramer?
It's their facility. I don't think we should be sending the county. I mean, maybe we can save some money, but it doesn't seem right to send the county employees to do work on a private building.
Supervisor McDevitt?
I'd like to see it done as quickly as possible for
I
the
agree.
reason that we're under guidelines as it relates to temperature of food being served to a senior citizen. So if we sit here and we debate this issue like it's you know, the remaking of the Magna Carta, we will be sitting here a year from this Christmas talking about it. So let's hope we can deal with the issues kind of quickly and efficiently.
All right, so are you saying then let the electrician that they've gotten the quote from move forward with it to get it done?
That would be my
Is that
suggestion.
the feeling of the committee, that that's the best way to go? Supervisor Sokol?
I thought Mary was looking into
So then all right, so then once you look into it, you're going to get back to Dee then and let her know which is...
Yeah, if you want to move forward, though, if I look at the lease and we decide it should be covered, I can pull the resolution myself. But if you want a backup plan, then maybe pass something in case it's not in the lease, and we can leave it in there for the board meeting.
Because otherwise we're waiting 2 more months because we don't have a ton of...
Yeah, no,
Yeah, we can't wait for... Yeah. All right, Mr. McGowan?
Yeah, I agree with Mayor. I think if we can have something in there, if it's not in the lease and we have to move forward, that we move forward. But I'll wait until Mr. Moore speaks his piece.
Oh, I was just going to say, yeah, preferably the facility does it because it's under their lease. It's a permanent fixture at their facility. But if it doesn't, we should get this done as soon as possible. Do we need this to go to the full board for a resolution?
Eventually, we'll need a contract to pay them.
Okay, so then they'll have to approve the contract. Maybe we could ratify the chairman's signature on that contract.
So we don't need to do
So
anything now?
Right, so that if it's determined legally that we can't cover it under the current lease and we do have to pay for an outside party, that we can just get that done. We don't have to wait around until the December board meeting.
All right, does that meet with everyone's approval? We'll move forward that way then. All right, any committee member have any other question for Dee? Oh, I need a motion to approve that resolution. Supervisor
make a
McGowan.
motion.
A second to that, Supervisor McDevitt.
What is it? Can you just say it again?
Yeah.
Sorry.
What do you have?
It's going to be authorizing a contract with Vacant Electric to install 3 new outlets for the meal transporters, contingent on county attorney review determination that it's not covered under existing.
We're not contracting with Dean. We have to amend our contract with Cedars, right?
Can we just do it to reimburse Cedars?
Why don't we just not do a resolution at this point? If
Okay.
the work has to be done, we'll do it, and then we'll bring it back for ratification. Because you're all aware of the situation.
Right.
We can move forward, and if we need to, we can ratify a contract.
All right.
That's
That work for
legal.
everyone? Okay.
You know how I don't like to do anything illegal.
This is how we're going to leave it. If there are no other comments from the committee, you don't have anything else? Does anyone in the audience have any questions? If not, then we are finished with Office of the Aging. And thank you very much, Steve.
20 amp, 120 circuit.
Now it's your turn, Chris.
Happy Thanksgiving.
Good to see you again.
No, don't sit in that one.
Not that one?
I figured you'd have something.
Just raises you up.
No, it
And it's
sits you different, and it's uncomfortable. I want to keep you awake.
Remember, Peter, we used to do music chairs at the city level because
Thank you.
there was only like 5 good seats and 2 lousy seats.
Aren't you nice?
Did you get one? You get one?
I think we're all set. Brad?
Thank you. Oh, that was country.
I guess I'll just have to come to the tavern after my pro bono electrical work there, right?
I think that's a great idea.
Okay, good morning.
Good morning, everyone.
Good morning.
Have a pretty small agenda here, so should be easy to get through. The first item I have is personnel requests. I have one intent to fill the vacant position of number 1 in the resources recovery unit. This is due to a promotion that was effective August 19th. It's a grade 4, the base salary is $29,333. Position is mandated first.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any questions? Okay, all those in favor? Aye. Opposed? Carried.
The second intent to fill is the position of caseworker 36 in the Child Protective Services unit. This is due to a resignation effective November 12th. It's a grade 16, base salary is $43,390. This position is also mandated and reimbursed.
Okay, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Lowe. Any discussion? Supervisor McGowan.
Would it be personally asked, the resignation, was it a better opportunity, or just didn't enjoy it anymore?
I think it was basically a combination of the two. Don't know the full extent of what this particular caseworker had planned for the future, but it's my understanding that she wanted to do some different things.
Because, I mean, it's a good-sized salary. I was just, wondering if maybe we lost him because of, more money someplace else,
That's generally what happens with our positions over there.
Just asking,
I
because I
don't know
know
if that
it...
was the case in this particular one.
All right, good. Because I know it's not being able to work with you, because you're just,
All right, Supervisor Driscoll.
Thank you, Chairwoman. I would just make the quick point that it seems to me, in my remembering, that rarely does a month go by that we aren't looking at a personnel request from the Department of Social Services. I think that's just the nature of the business, people coming and going with a large staff.
Exactly. We have a pretty large staff. turnover.
All right, guess we'll vote on that now then. All in favor?
Aye.
Opposed? Carried. Thank you.
You. The last item I have is to request a resolution for permission to enter into an agreement with the Warren County Public Health Department. This is to provide child welfare and community health services for the Department of Social Services. It's a term commencing December 1st and terminating November 30th of 2020. The funding is going to come from the Child Abuse Prevention and Treatment Act, otherwise known as CAPTA, and the Comprehensive Addiction and Recovery Act, which is known as CARA. This is for the state fiscal year 2019 through 2020. It's in the amount of $20,000.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor Driscoll. Anyone have any questions? All right, all those in favor?
Aye.
Opposed? Carried. Yes, Mr. Moore.
Can I just comment and thank the Social Services Department for doing so much with our other departments and really integrating everybody. You have Department of Health, Employment and Training. You're doing something with probation. I think it's great.
Thank you for that. Yeah, we have a lot of collaboration within the county departments, so it is nice. And as you know, we have recently had one of our employees recognized as Employee of the Month for doing that. And while I'm on it, I'll add one more thing. I'm really proud of our department in regards to some of the volunteer activities that they do. One of the things that our department really, I mean, all the units are really good at this, but especially when it comes to veterans donations and for donations to organizations like that. And we probably had, I would say, 8 separate units demand that they themselves collected their stuff for veterans this time. We also have all 3 floors over there donated to the Salvation Army, so they do a really good job day in and day out, and they go above and beyond collecting donations and volunteering at various organizations. So
That's wonderful. We appreciate that too. What's next, Chris? Okay.
As far as the budget through October 31st, 2019, our expenses are at about 75%, so we're in really good shape for the year. I don't foresee any issues with the 2019 budget. The revenue is at 77%, so that's even better. And for overtime, again, with turnover, we had 2 new fraud employees, so their training was pretty intense. There was a lot of training for fraud. So we just keep plugging away there.
All right. All right, questions? Supervisor Lowe.
Just a question about the status of the employment as far as, have we caught up with the vacancies and the training? Where are we as far as having a status totally up to speed?
Okay, so you're referring that to Chris, right?
I am.
Okay.
can you rephrase that more specifically?
A year
I
ago,
want to make sure I'm answering
if I may,
who
Madam
you
Chair.
want.
Yes, go ahead.
The answer you need to hear.
A year ago, what answer do I need? A year ago and before, we had a lot of overtime, and which is fine, but one of the reasons was because we were short on staff, so people were filling in the holes, and then we had to hire people, but it takes a while to train them. So months have gone by. Some of these jobs take a year and a half before they're really top-notch, but where are we as far as being a basically fully staffed, smooth-running operation?
I think right now, I'm pretty pleased to report that we're probably at the best staffing that we've had in quite some time. All of our caseworker positions are full, except for one for today. We have probably 3 or 4 other openings. but they're going to be mostly promotional, so when people get promoted to those positions, of course, we have to ask to fill the backfills. But from the standpoint of staffing, I think we're really at the best staffing we've had in quite a while. We obviously always have turnover because it's a stressful job, it's a hard job that requires a high degree of knowledge and commitment. And to be quite honest with you, the pay probably isn't commensurate with that in some of these jobs. So people will look for other work. It's just natural. But I think right now we're at probably the best point we've been at in quite some time as far as our staffing levels. But one of the things that comes along with that is the training. So when it relates to overtime, we have a lot of people going to training in Rensselaer. So that, does add a little bit to the overtime. But I think it's starting to get to the point where we're going to start really gaining some traction. We have a lot of new people that are really seem like they're going to work out really well. So I'm pretty excited about that.
It's encouraging to hear that, too.
Thank you, Madam Chairman.
Driscoll.
I think one of the reasons for that this past year was, I think you had as many as a handful of senior staff or upper-level positions of individuals who had retired. And I don't know if this is a question appropriate to Supervisor Garrity and the Personnel Committee, but would it be responsible for the for departments to notify the Board of Supervisors of information about retirements, when they're expected or when they're already have been put in for, so that we can kind of gauge where we are as far as referring to personnel requests in the future? I mean, especially if some of those personnel requests are going to be because of retirements. I don't know if that's already taken place or not, but I think it would be helpful. I mean, I certainly am aware of situations in one department here on the county level, but I think it would be helpful, at least to me, to know about that type of stuff.
We don't always know, but if
Okay.
we know or somebody does say that they're planning on retiring, we have to look at our budget as well for payouts for health insurance, sick time, vacation time. So it's something that we put into our budget, but people don't often come to us and say they're going to retire. And we've had a couple retirements that people leave because of medical issues or other emergencies over the last couple of years, so they didn't probably even realize they were going to retire that year. But certainly it's something that we can notify people about if we hear about it.
Okay.
All right. Any other questions? Chris, I guess we're going on then to Countryside.
Good morning, everyone.
Good morning.
Morning.
So my agenda is a little bit larger than usual. The first one is an intent to sell for cook position number 5, a grade 4. Annual salary will be $29,333. It'll be effective January 1st. Main reason being that we're deleting the food service position, part-time position on January 1. The new position will help limit overtime and keep the retention of staff.
All right, sounds good. So I have someone make that motion, Supervisor McGowan, seconded by Supervisor Sokol. Any questions? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Second request is to go into a service agreement with Action Septic for biannual inspections and cleaning of the building sewer lines. The cost will be $1,260 annually with a total not to exceed $2,000. The rationale is the preventive maintenance. The building's old. Let's get ahead of it before we have issues.
Makes sense. Someone like to make that motion, Supervisor Driscoll, seconded by Supervisor Lowe. Any questions? Mary.
I'm assuming you're including the not to exceed at $2,000 to include any repairs that might be needed.
Yes.
So I would just ask that the resolution also include repairs.
Okay.
Okay. All right, now, did we make that motion and second it? Yes. All right, you have a question, Mr. McGowan.
Yes, do we already do this?
No, we don't. We had an issue back in July, and
it really was an eye-opener as to why we should be doing this.
And how often will they buy in, or so twice a year?
I want to do it in January and July, yeah.
Okay, well,
Makes sense. Ms. Bramer?
Where are we with connecting with the sewer?
We just,
We just did that?
No,
at the last committee, we approved, in Public Works, we approved that agreement with Warrensburg.
we did.
Yeah.
but this is really the internal lines of getting it outside the building. Because I'm sure once it's outside the building, it's in the new plastic. I'm sure these are in the old cast iron due to the age of the building, and they're a little rough.
Yeah, exactly. This is maintenance that should be done on a regular basis to assure that everything is working as it should and as efficiently as it should. As far as in regards to drainage, if there's an issue, it can actually end up costing more than this to repair things and clean up. It can also result in Department of Health issues as well. So
Mhm.
this, I think, is a really good idea to have this done on a regular basis.
That's a good idea. Mr. Moore?
Did you check with Brad to see if he could do it pro bono?
We'll keep him busy. All right, we'll vote on that.
Thank you all.
Okay, all those in favor?
Aye.
Opposed? Carried. Thank you.
My next item is the renewal of the eStyle membership. It'll be $13.44 for a one-year period, and that's based on $28 per bed at our max of $48.
Did we skip number 3?
Did I? I'm sorry.
That's all right, but I just want to make sure we get it in there.
Do you want me to finish number 4? Or?
Let's just do number 3, and then we'll move on to 4.
Okay. We want to renew the service agreement with Hudson Headwaters for the employee physicals and the PPD placements. This is mandated. The price has gone up a little bit this year, but it's going to be a 2-year contract.
Okay.
So it's $127.50 for, or yes, $127.50 for each physical, and the PPDs will be $16.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, now on to number 4.
Right.
So as I was saying, the eStyle membership really, it's been a tremendous resource this last year.
Okay.
The compliance that we have to do to the Department of Health and, the regulations, they're complicated. So just having a resource to go to, like, I'm reading it this way, what do you guys think? It's been invaluable.
That's great. So it makes sense to continue with that then. Someone like to make that motion? Supervisor McGowan. Everybody else must be tired today. Seconded by Supervisor Sokol.
I
Any
worked out
questions?
yesterday,
Is that
and
what
my
it
arm just keeps going like,
Okay. Any questions? Yes, Mr. Garrity.
What's that stand for?
Empire State Association of Adult Living, I think. Empire State Adult Association Living.
We vote on that. All right, we need to vote on. All those in favor?
Aye.
Opposed? Carried. Thank you. Number 5.
We need to request transfer of funds from hospitalization and salaries to the retiree hospitalization and workman's comp and salaries for overtime. The amount that will cover us through year end, the total amount is $12,854.
$12,854. Okay. Would someone like to make that motion? Supervisor Loeb, seconded by Supervisor McDevitt. Questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
Last action item is a request for appropriation from budget code 603413 to the reserve account A861 in the amount of $38,000. This is to transport and install a larger generator, the generator from DSS to Countryside.
right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. All those in favor?
Aye.
Opposed? Carried. Thank you.
Overtime looks good. I mean, we are down. I mean, as we're filling the positions, we're in really good shape.
Good, looks good.
The census is up compared to last committee meeting. We're up by 3.
Oh, really? Wonderful.
Just as a good news story, so this year we did, instead of a family picnic, we did a fall festival at Countryside, which it was nice. It was really nice. And what we did was, instead of, a lot of times resident families will bring desserts and stuff, so instead of having them do that, we asked them if they would like to donate a non-food, perishable food item or an unwrapped toy, which we collected a tremendous amount and donated to the North Country Ministry. So
Oh, how nice.
kind of want to give a big shout out to our residents and families.
That was nice. Very good idea.
Amy and her staff did a great job on that.
Yeah, that's wonderful. It's nice to see everybody doing that type of thing, being willing to contribute to those.
Bah humbug.
Okay. Anyone from the committee have any questions? Anybody from the audience have any concerns they'd like to bring forth? If not, then I guess we're all set with social services. And thank you all.
Thank you,
And happy Thanksgiving to you.
Bill.
Other berries.
Yeah, ask David Cunningham.
Oh, it's making my eye water when I stop looking at it. I wasn't sure where you at.
My goddamn, I gotta go to dancing tonight.
Close to the,
And then I'm on aspirin plus my heart.
Good morning. How are you?
I have, cut off the board.
So good, so you have it, so you get it fixed and you decide to come back.
But that's probably why I leave.
Thank you.
That extra.
Ben, is that the inn under your department? I was trying to put 2 and 2 together.
I know how to close my eyes, but I haven't figured out how to close my ears sometimes.
How are you?
I like how she doesn't talk to you though. It is, no, it just happened.
Good morning. We're all set, Janelle. I think.
Hey, good morning, everybody. First is to request resolution to request referral to the Personnel Committee to approve filling a vacant part-time medical coder position, which was created in the 2020 budget. The part-time medical coder position was created to assist our agency to correctly code diagnoses and optimize revenue.
All right, someone like to bring that to the floor? Supervisor McDevitt, seconded by Supervisor McGowan. Do you have any questions for Janelle? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
To request resolution to amend contract with the health services therapist to include verbiage to comply with the Article 28 and Article 36 regulations, including but not limited to 763.13 personnel and contractor requirements, and also to reflect the rates in the 2020 budget, further allowing up to a 5% rate increase with automatic contract renewal unless 30-day written notice by either party.
All right, someone like to make that motion?
No, it's a long one.
Yes.
It is.
If you have questions, we'll ask, but if we could bring it to the floor first,
Okay, I'll
that
bring it
would
to
be
the floor.
good. Right, Supervisor McGowan, seconded by Supervisor Loeb. Now, do any of you have questions? I know it's a lengthy one. Mr. Loeb?
Thank you, Madam Chair. Just a clarification. I mean, it seems straightforward, but it's really not. It's kind of an odd wording, because allowing for up to a 5% rate increase with automatic contract renewal. But mean, we're here to do the renewal, we're here to approve the increases, and
I think most of the contracts I bring up, that's been encouraged, I think, by the county attorney's office to save time and effort, is if there's not going to be over a 5% rate increase, to go ahead and renew automatically. I mean, that doesn't necessarily have to be in here, but it's easier for managing a lot of contracts.
so this is not unique.
It's not unique, and with our therapists, we've not historically raised the rates in a long time. So with the budget process, we just raised the rates, and we didn't even raise them across the board. It was for specific evaluation visits. So, I mean, I'm not anticipating rate increases. However, for the automatic renewal, that's helpful for the county attorney's office. I don't know, Mary, do you want to say anything?
I don't know about that policy, but I'll speak to Ryan about it. I don't know if he had that discussion with you. But it's fine with me. I mean, it works for us.
All right, Supervisor McGowan.
Yeah, they can ask for it, but I'm sure there's a process of, you're gonna evaluate to see if it's worth the 5%. We might be able to say, hey, you're only worth, 1.723%, maybe, or, I don't know.
We're not at all.
All right.
All right,
Okay.
anybody else have any questions? All right, all those in favor?
Aye.
Opposed? Carried, thank you.
That's a budget decision.
All right, next is request resolution to authorize Jignasia Shaw, our Public Health Program Coordinator, to receive reimbursement according to the CSEA union contract for a job-related course, which is HEP 501, which is Principles and Methods of Epidemiology, and related course expenses upon successful completion of the course attaining a C or better. That's attachment 8. With all the backup, this course provides information on epidemiology, which is a core component of public health, providing understanding of illnesses and other threats to public health. It's also a requirement for a certificate in public health.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any questions on that? Supervisor Bramer.
Thank you, Chairwoman. I seem to recognize this individual's name. Is she getting close to her certificate in public health, or what is she going for?
This is the third course, and it's a 6-course certificate program.
And
She's
you're-
going for a certificate in public health.
And it's your recommendation to us that we should have her pursue this under county?
Absolutely.
All right.
All right, Supervisor Driscoll.
Thank you, Madam Chairman. This also kind of relates to some succession planning, which is an issue that we've spoken about at a lot of meetings for different departments. Having individuals who are trained and have the credentials to basically maybe jump in to succeed an individual who may move into a different responsibilities or leave the county.
It's also a standard that the state health department's encouraging, is that our public health staff have training in these 6 core essential services, which the certificate's based around. Then if she wants to continue, she could then go for a master's. But this is just kind of a basic 6 core components of public health that she's working on.
All right, thank you, Mr. Driscoll. All right, we'll vote on that one, please. All those in favor?
Aye.
Opposed? Carried, thank you.
Request resolution to amend current agreement with Adirondack Health Institute to receive additional funding not to exceed $10,000 to continue with the Prevention Agenda Public Health Improvement Project, which is providing fresh produce for women, infant, and child participants. Funding will be utilized in 2020, so we're requesting the funds received prior to that be placed in a deferred account, which is A691.00. Documentation is on attachment 9. This project's been going really well, and we received $3,000 extra additional funds, so we're wanting to be able to utilize that.
Okay, very good. A motion by Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The next resolution request is kind of a buddy request to the previous one.
Right.
And that's to amend our contract with Field Goods to purchase additional produce not to exceed the $10,000 based on funding received from AHI, which is on attachment 10. Additional $3,000 was received from AHI, which will then be utilized to
purchase the additional produce from Field Goods to benefit our WIC clients.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor Sokol. Any questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
All right, and the next request resolution, I'll let Con go over. It's to transfer funds, and then I'll let her go into attachments 1 and 2.
Your last page is attachment 11. It's basically transferring funds, and near the end of the year, there's a lot of analysis of both salaries and fringe, which we have to come to committee. So it's going through each department pretty much and just trying to transfer those funds so we can cover to the year end. My best guesstimate. I don't anticipate anything major changes.
Okay, sounds good. If you look at attachment 11, you'll see the amount that she's looking at having to transfer. Would someone like to make that motion, please? Supervisor Loeb, seconded by Supervisor McGowan. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Now to attachment 1, which is our financials as of November 11th. And gives you your year-to-date numbers at the top, and again at the bottom, we look at those salaries. We're just slightly above last year by less than $6,000. One thing again to bring to your attention is that this is as of the end of October for payroll, which would be about 83% of the budget if we were the end of October, and we're at 71.61. So we're doing well when it comes below the budget, and of course due to union increases and negotiations and everything else, we expect eventually to catch up and be over last year.
Right.
So we are slightly over, and of course we will by the end of the year, but at least as of right now, when it compares to budget, we are under budget, which is
good.
Attachment number 2, which again is comparing last year to this year. Again, the salary information, nothing major there, slightly with the contractual, which are expenses that we a little bit under, again, just due to timing of billing, and employee benefits due to the fact that we have some positions that haven't been filled that are full-time positions, and I also think just one or month or something isn't been posted yet. So it's just a matter of that.
All right, next is the status, I'm sorry, any questions?
I was just going to say, does anybody on the committee have any questions? Guess not.
All right, status of referrals for attachment 3. Val, do you want to review?
Yep, for September of 2019, the referrals were 93 for the nursing. And we do have the 54 for physical therapy. The amount of visits for the month of September was 1,243. We do have 2 nurses, I believe, out on medical leave and 2 nurses out on FMLA. Any questions there with the status?
Anybody have any questions? No? Thank you.
The emergency response.
Sorry.
Excuse me, Mr. McGowan.
Yeah, sorry about that, delayed action there on the arm. I know we've talked about this before, our numbers are down a little. I mean, it's, and I know we're trying everything possible. I mean, but just to refresh, it was really just due to the extra competition that's out there?
No, competition does have some to do with it. Also, hospital census is being down. It's going to affect the amount of referrals that we get. And then the other thing is insurances are having more and more patients that go into the hospital. They will pay for them to go into an observation status.
Okay.
So when they go into observation, come home, they come home to us as a revisit versus a new referral.
That was what it was. All right, thank you.
You're welcome.
Yes, and thank you.
All right, the emergency response and preparedness report is attachment 4. Also, the rabies report is attachment 5, included in your packet. And for informational items, November is National Home Care Month. Warren County has a dedicated staff and provides quality care and services for those in need. We encourage you all to like us on Facebook so that you're able to keep up with what we're doing there and maybe help encourage our services to go to your friends and family. So help us spread the word. We had a unique way of celebrating National Home Care Month this year. New York State Health Department came to visit and do a surprise survey November 4th through 8th of 2019. So when they were here, overall, the surveyors said that it was a good survey. They were very impressed with our staff and found that our patients were satisfied with our staff and services as well. They will send us a report within 10 business days, which we're anticipating to be this Friday, and then we have 10 calendar days to respond with a corrective action plan. There were some citations, however, none are thought to have compromised patient health and safety. For example, one of the resolutions that you voted on was to change contract language. We already had that in practice. We already had it in policy and procedure, but because it wasn't in the actual contract, that was going to be a citation. So we're kind of acting on that proactively before we get the official letter.
Okay, good.
Thank you for your help with that. Also, while the surveyors were here, we had visit from the Chronic Disease State Health Department office. They provided a presentation on Governor Cuomo's cancer study findings, which was held November 7th at SUNY Adirondack. There were about 50 people in attendance. Based on the available data, behavioral risks such as smoking was found to be one of the greatest risk factors for cancer in our area. Public Health has been and continues to work with local partners through the Community Health Improvement Plan process, where we identify education and outreach opportunities. Many in attendance were concerned with environmental related to air and water quality. Environmental contacts such as DEC and the State Health Department were provided to the people there. If you're interested in more information on the study, I included the link, and if you're interested in the presentation that was provided, that's also provided for you as well in a link. Also, in November, we did a vaping panel, which was hosted by Glens Falls City School District. It was held on November 12th from 6 to 8 p.m. Dan Durkee and partner agencies have put a lot of great effort in a successful program. It was originally held at Lake George, so it was backed by popular demand at Glens Falls High School. So a couple of the supervisors, Supervisor Bramer and Driscoll, attended as well. For staff, Kara. We had a Kara grant renewal that you probably heard from DSS when they were in here, but they requested through the Health, Human, and Social Services Committee a continued agreement between DSS and Health Services to continue collaboration for families affected by substance abuse and the development of a plan of safe care. Public Health will receive $20,000 for the period of 12/1/19 to 11/30/2020 in monthly installments. This is down from the $50,000 that we received last year, but we're adding, Social Services is adding another group, which I think is very important to that table, the Council of Substance Abuse and Prevention. For a staffing update, home care has 2 nurses out until further notice and 2 nurses on intermittent leave, as Val mentioned. We do have 1 nurse starting in December, good news. This will leave our agency with 1 open full-time position in addition to our per diem opportunities. And with that, that's all I have, with the exception of to thank you all for your support over the year and to wish you a healthy and happy holidays.
Well, thank you. We thank you for the wonderful job that you do all year long, too, so you're greatly appreciated. Ms. Bramer.
Thank you so much. On the vaping panel, it was very good. This was originally some of the information that was presented to the board after one of our board meetings way back, I want to say February or March, and a few of the supervisors stuck around, but it's very alarming to hear the rate of vaping or smoking e-cigarettes that's happening with our young people. People as young as 13 are trying this, and they're getting hooked because it's the amount of nicotine in the vaping products is very, very high. It ranges a lot, but it can be way more than just a single cigarette. And they're doing it now. It's like a techie thing, and the kids think it's cool, and they think it's not doesn't have a harmful effect on them, but it's actually very, very dangerous, and it's something that we need to be talking about with our kids so that they understand that it is dangerous, and they're not just vaping water particles, because a lot of them think that that's all that's going into their lungs, and that's not true. So I wanted to throw that out there, and also mention that last week the legislation from the state prohibiting sales of tobacco products, which includes the e-cigarettes that they use for vaping, the legislation prohibiting sales below age 21 went into effect on Wednesday. So we should be seeing some sort of, hopefully, positive impact with the amount of kids doing tobacco products. But I also raised this to our committee to see if there's anything else that we should be doing. There were some other suggestions about what we could be doing locally to curb the usage of these products by our young people. And some of that could be maybe prohibiting flavored products. They have vapes that are in bubble gum flavor and like pina colada and stuff like
Yeah,
that. Which
flavor
is
you want
obviously
out there,
for
yeah.
kids. You know, and another thing is we have a lot of vaping shops in the county, so maybe something that we want to do, like you can't have a vaping shop within so many feet of a school or something like that. I don't know. But I would like us to continue looking at that, though, because it's a really alarming trend, especially with the cancer study that just came out, too, saying that this is a problem for us, a public health problem.
Thank you for bringing all those things up. I appreciate that. Mr. McGowan?
Yes, along with Claude. Now, did the state, are they going after flavored, or was...
They tried to, but they got sued by the industry.
Well, of course, because, I mean, it's huge. And I was saying, because you get rid of the flavors, excuse me, you're going to be taking out, you know, some of the participants of it, so... But it really is amazing when you're driving around and you watch people with the windows open and, you know, you see this big, and for kids and parents to say, you know, it's not harmful, I'm like, holy mackerel, you see that it looks like a choo-choo train, a steam train, you know what I'm saying, coming out of the window, and you're saying this vape is not hurting? No, come on.
All right, Mr. McDevitt.
No, it clearly is a public health issue, and appreciate the efforts of you guys in terms of trying to stem the tide, but we have, like a lot of things in this world, a lot of money, a lot of marketing, a lot of PR, and kind of sucking young people into a trap, and it's just, you can't be putting this kind of smoke into your lungs and expect to live a healthy life. So it's got to get to kids at an early age, as Claudia obviously is doing, and it's important.
I made my daughter go.
Yes, Cynthia?
Are adults allowed to vape in public buildings?
No.
They're not?
It's
Because,
the same rules, right?
Same rules as
Same rules
smoking.
as cigarettes.
Yep.
I mean, is there an effort to focus on the role models of the adults? I see so many adults that suck on those things constantly, and they never put the darn things down. I mean, they're the ones setting the example. There should be a push to educate them on what kind of example that they're setting.
The same rules apply to cigarette smoking as they do with vaping and, you know, in public places and that, so.
Supervisor Driscoll?
Thank you. I'll be brief. I mean, there's clothing that you can buy just to basically blow your smoke into. The whole industry, I mean, sees one issue and then they
Oh, my gosh.
They try to find a way of skirting that issue. So one of the points that I made at the presentation was, I mean, government can have its part in trying to do better by this situation, but ultimately there's some parental responsibility, and if you've ever had children or grandchildren, I mean, you know, you still have to be responsible for making the calls and educating and informing them, and then with the support of government too. But you got a monster as far as Peter said, the advertising and marketing industry trying to capitalize on basically innocent young people.
All right.
Amen.
Thank you. Anyone else have anything for the gals at the other end? If not, I'm going to entertain a motion to adjourn. Supervisor Loeb, seconded by Supervisor McGowan. All those in favor?
Give me that last one.
I think the rest of them were tired.